Adversity Psychologist podcast. I'm Dr. Tara Quinterillo, and today we have a part 2 of our podcast on FND with the wonderful Dr. Michelle Gregory. Do you want to say hi? And anyone who hasn't caught our first episode on FND yet, just introduce yourself, tell us a little bit about who you are.
So, hello everyone, my name is Dr. Michelle Gregory and I'm a clinical psychologist, and my area of specialism, expertise and passion is functional neurological disorder. And last week we talked last time we talked a lot about what FND is and my personal experience of it. And so today we're going to be focusing on what rehab looks like in terms of functional neurological disorder, because it's so different for everybody and there are different options out there for people. So thinking around how we can support people to get help.
So if anyone hasn't listened back yet, please listen back to our last episode. So we did some really good work. Actually, it was a really well received episode. It's one of the best received episodes that I've done. So I'm really super proud of what we achieved with that. But there's something about, what FND was, what it isn't. And you use some really wonderful phrases to try and explain about. People seem to know what FND is, but don't at the same time. It's something people hear, but actually, what is it? So please listen back to that episode to just get an idea about what the barriers to getting the diagnosis are. But obviously we couldn't fit in that kind of 50 minutes, everything. And today what we want to do then is bring in, so how do we work with it? What's rehabilitation look like? But also sourcing help, because obviously we're both psychologists who work privately. We charge fees for our work. There can be a lot of myths, a lot of misconceptions about what that might look like then if you're reaching out for that private help. So we want to bring that in as well, don't we? So let's start with rehab then. Where do we start? That's a good question to begin with. Where do we start? What does that look like?
So the first bit of rehab is always psychoeducation, which is interesting because that's essentially what we talked about last time. So lots of
useful.
What is FND? How do we understand the mechanisms of it? Does this make sense to what you're going through? Because that is such an important light bulb moment of
it really is.
Oh, because I thought that was really weird, or I would be the only or it didn't make sense. And then so that's why my body's doing what it's doing.
Yes.
And the importance of, so the first part is always psychoeducation, explaining what FND is, what it isn't, and if you can help somebody make those connections or have those light bulb moments, you're cooking with gas. And then what that does, the mechanisms behind that, is it gives people, technical term, psychological safety of oh, okay, this is a thing, this is what's going on. And what is more helpful in rehab, it's less of the why in the initial bits, because we can never really know why, but it's more
that's a good point.
But lots of things we can never fully know why. Like as psychologists, we're skilled and we're trained in what we call formulation, which is essentially how do you make sense of what someone's going through. And that's in best practice, that's shared, and it's kind of linking in what we know about theory, about what's going on in someone's life, but we don't know what we don't know.
That is another classic, brilliant Michelle phrase that I think people need to hold on to.
And I suppose in order to get better, you don't really need to know exactly why you developed FND. But because what helps you get better is knowing how does this show up for you? What are the mechanisms for you? So talking through the mechanisms of what we talked about last time, which is thinking about attention. And so that can often be around, and with a good formulation, it leads you to then what do you need specifically to help you? It's that kind of golden thread of how does this make sense of your background? What's happened to you before now? Why now, maybe? And what we can often do in psychological rehab is thinking about the why now. So that for some people that might be trauma, other people it might be burnout, it might be undiagnosed or diagnosed neurodiversity. and living in a situation where your neurodiversity is not particularly well thought about or held in mind.
Yes, yeah. And we know that there's a lot more kind of media attention on that, people that have got either misdiagnosed or missed, especially women. So people can refer back. I've done a couple of different podcast episodes on that if people want to link those episodes to this as well.
Absolutely. And because and particularly women or non-binary people, quite often we were good people. We were polite and paid us and could focus, and then it came out maybe later on in life with increased demands, or it might have come out like in different settings. So part of the psychology rehab is kind of maybe thinking about the why now, because what that can also do is go like, oh, okay, so if that's made me a bit more vulnerable to this, or these are my triggers. So lots of the psychological rehab is helping you identify your triggers and reduce them for a little bit, to allow things to kind of settle down, and then slowly increasing your tolerance towards them in a way that is kind of mindful and intentional. And so we do lots and lots of work around boundaries in lots of psychological rehab. So because quite often many people with FND, we can really struggle with saying like no to certain things, or knowing when our bodies are saying no. And so if we're not very used to like those whispers and our body whispering to us, or we kind of go la 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 la, yeah, that's fine, body, that's cool, thanks for telling me, but I've actually got all this stuff to do, thanks very much, I've got to get on with that, so just shh.
All of life's demands, and we're in a fast-paced society, aren't we? You know, instant emails popping up here, there. We can get really quite easily into those unhealthy cycles of needing to respond. I haven't got time for anything else that's going to get in the way.
Yeah, and you don't have to have FND to kind of go into that trap either.
Absolutely, yes.
So, and again, this is part of normalizing it as well, that many of the reasons or mechanisms behind FND, they're not some unique thing. It's quite often what many people experience, but it just, that stress or that pressure or those reduced bandwidth comes out neurologically.
Well, I think quite a nice, compassionate way of phrasing that, but also coming back to your really good point before, that kind of question of why, it's very easy to get stuck. Why has this happened to me? And anything, not just with FND, but actually sometimes it can be unhelpful, because that can actually stop you from moving forward, looking at solutions. So I think that's quite an important thing to get across to you. You know, that kind of why now is a very different question from why is this happening to me? You know, there can be shock. It's a natural question to ask, isn't it? Why has this happened to me? I need to find out why, because we think that the solutions lie in the answer to that question, don't we?
Absolutely. And if you think about ruminating and how ruminating can sometimes be a bit one of those things that pretends like it's helpful, and then it sneaks up on you, and then you're like, oh no.
If I sit here long enough and worry about it all and go through it all, then I'm in complete control, and this answer will magically appear.
Exactly. And that element of control is, why wouldn't you want to have control when your body is out of your control? When thinking and ruminating might be something that's in your control. Absolutely. So as in the psychological aspect of rehab, we can often if control, or if like ruminating's part of going on, having a compassionate person to, because we don't learn in our learning disability days, we don't learn by taking away, do we? We learn by adding in, helping people develop new skills, and you can only learn when you feel safe.
So for those people that might not know us and our history, we worked together many moons ago, or maybe I'll just say a moon ago, otherwise it'll sound super old, in services for people with learning disabilities, didn't we? So sometimes we bring in some of our history there, some of the things that we used to do with that client group, which are quite applicable to other people as well.
Absolutely. And actually there's lots and lots of work that I do that's quite applicable from learning disability work with FND work, and thinking about like how, when almost kind of thinking about that traffic light system of when things are really, really hard for you, what do you need in place? How can you reduce the demands, but what can you still do that can, or what skills do you need, or what support do you need when things are like you are really struggling, your paralysis is really hard, your tremor's really tricky, you're having seizures a lot. How do we reduce the demands on you, but still help you identify what you can do that makes you feel good, competent, connected, how feeling safe in movement? So so and then it might be that when you're getting there, like when you're in the amber stage as well, you might be like, okay, I'm recognizing this, what do I need to kind of be putting in? Or it might be that you're coming down from like things being really quite tricky.
Yes.
So how do I start increasing it? Because that's really common, both in FND and actually in lots of my long COVID work that I do in the NHS, is how do I know when I can start increasing the demands so I've needed to kind of cut things right back to look after myself and to recover. How do I know when I'm doing more or am I pushing it? And that balance is so hard to know, because there is no right answer. And I really wish there was. And so in terms of the psychological rehab, in terms of fatigue management with FND, it is around how can we help you feel safe to try it out and to see. So say, for example, you really, really want to go to your children's play, or you want to go have a drink with a friend, or you want someone valued stuff. It's really important, and living with FND can be really, really isolating. And so how can you do that? And then feeling okay to test it out and knowing what might you need. Might you need to take things, pare things back and plan in lots of rest time on the day, not just the day, but 2 days afterwards. That's the thing around like the particular type of fatigue that comes with FND, long COVID or chronic fatigue. It's not the day after, it's the 2 days after, and it sneaks up on you where you're like, oh, I think I've got away with this. And then the day after, you're like, no, I didn't.
That's a really good point. So just picking up a few things, adding some threads together. There's something there around those initial boundaries, saying no, scaling back on something in those kind of early days. But then we might get a familiarity or a comfort around not doing certain things. And then is it all right to ask, can there be fear? Because that's something that came to mind for me then about starting to reintroduce things. How to introduce it, what it looks like, but the fallout then, you know, because I can imagine for some people, and I've worked with people with all sorts of different conditions where this might apply as well, that, well, actually, is it worth trying that thing if then 2 days later I'm going to not be able to do stuff or have to take some time off work again, or, you know, that kind of backwards and forwards. It's tricky stuff to talk about, but I imagine that those are quite big barriers to people moving forward.
Absolutely, because the cost is real. And if you're self-employed, or if you're working in an environment where people don't get it, or if your family don't get it, then it can be really hard to feel safe enough to try it out and to trust that you can both like, I guess, like there's the psychological barriers, but there's also the real practical social barriers that if you're concerned you won't get paid 2 days, or if you're like verging on that, like you've had a few sick days, and then you know that might tip you into a disciplinary if you take off another day. Having someone to be able to kind of mindfully and intentionally weigh it up and go, okay, if the cost is too much, is there a way you can do this in a less tiring, in a less demanding way? So rather than going out for a coffee, can you invite someone back to yours? If you're too tired to or if your FND symptoms are getting in the way of your house being clean and you're a bit embarrassed to have people around.
Yes, yeah, it's a good
Been
point.
there. It's really hard, but then it's thinking about who do you feel safe with, who are the people who really get you and can come round and be like, it doesn't matter what they're doing, what your house looks like, they just want to spend time with you. So, and that's what I love about what we were talking about. You're always bringing it back to values. That's what I love about your podcast and like your way of working.
Thank you. Values is so to me, it's just the core of what I do. And I think helping people understand that difference, the goal might be, I need to invite someone back for coffee, or, the goal might be, I've got to make this kind of progress. But actually, if you come back to the values that underpin that, why is it important for me to connect with someone? Why is it important for me to engage with this rehab in a certain way? I think you bring a certain element of compassion in as well, don't you?
Absolutely.
And I think just people listening, actually, that's really important. That it sounds very person-centered, the rehab. It's not a kind of a one model fits all. Is that right?
Pretty much. I mean,
right.
So I'm going to be a bit geeky and go into the evidence base, but all the
Please
evidence.
Bring it on.
There's been lots of different trials around what works for FND.
Yeah.
And the number one phrase, and it's a bit of a technical phrase, but the response is heterogeneous. And what that means is people respond in different ways to whatever. It could be CBT, it could be medication, it could be acceptance and commitment therapy, it could be psychodynamic therapy, it could be just physiotherapy. Everybody responds different. So if you've met one person with FND, you have met one person with FND. It can present
another good Michelle phrase. Yes.
And it can present so differently because each person's symptoms are different depending on, and each person and how they show up and why they show up are going to be different. So whichever, and I've talked a lot about psychological rehab, and I really do want to talk about some what physiotherapy rehab and what occupational therapy rehab or what speech and language therapy rehab can look like, because allied health professionals are such a key part of FND rehab, and locally in the NHS, you're more likely to be able to tap into an allied health professional to help you in terms of the NHS than a specialist psychologist, which is a shame, but it is what it is.
Yeah. But I think, again, this is useful information to people to know.
Yeah,
isn't it?
absolutely.
If we have information, we can make choices about what we want to do with that.
Yeah, absolutely. So once you have your diagnosis from a neurologist, more than likely what you would get is a referral up to one of the specialist London services or kind of national services.
Okay.
And they are excellent, and they offer multidisciplinary intervention, or both outpatient and day patient, and sometimes inpatient, which means people actually staying in hospital to get better.
Yes. Okay.
I don't think I would be saying 2 out of 10. However, unfortunately, the demand far outstrips capacity. So sometimes waiting lists are really long.
I was going to ask about that, in terms of just letting people know. And I guess, does that vary on location where you are in the UK?
Yeah. So, and some places in the UK do have local services that people can be referred to. Others don't. I know more about Sussex. So Sussex, unfortunately, there isn't any. We do have a non-epileptic attack disorder service that's based in Haywards Heath, and it does cover all of Sussex. So if you have non-epileptic seizures, you can ask to be referred to that service.
And that's East and West Sussex as well, is it?
East and West Sussex, yeah.
Okay.
Yep.
That's quite a wide area.
Yeah, absolutely. And other than that, in terms of NHS, you'll probably be looking at your local physiotherapy services or adult speech and language therapy services or occupational therapy services. Which local service that particularly comes into will vary depending on your location. So I can't go into exactly how that might be and what
And
that
just
might
to
look
clarify for people as
Yeah.
well, it's not
Yeah.
necessarily then that it would be a specific FND service that has these things
No.
within it, that this could
No.
be, standalone services that you're then signposted to.
Absolutely. And there might be, and I do know that there are little pockets of people, and I can only say from Sussex, that there are pockets of different clinicians with different areas of expertise and interest. So it's always worth asking to be referred to a local service, just in case somebody in that local service does have an interest or that.
But that's good advice as well. That's something in your control to ask.
Yes,
find out that information. Yeah.
Can't guarantee it, but yeah, you're entitled to ask. And so if you do start to see and best practice is to have like a multidisciplinary approach, that everybody working together. Sometimes that's possible, sometimes it's not. But it's also there's also some evidence as well, but you don't need to, even though FND is a neuropsychiatric condition, so there's the element of the psychological kind of emotional processing aspect. There's been some evidence that if you do have motor symptoms, so problems with paralysis or tremor, you don't necessarily need to see a psychologist to get better. Having physiotherapy input in itself can have as good outcomes as seeing a psychologist. And what that involves is helping you feel safe in movement.
Yeah.
So, and it's really important to think about with physiotherapy, it often looks the same from the outside, but the reason how it's working might be slightly different. It's not like, if I do this and I do these 10 reps, this will help strengthen up my muscles. It's not necessarily about the amount you repeat the exercises. It's more around how do you start to feel safe with the exercises.
That word safety's come up a lot already, hasn't it?
Today. Yeah, because you can't. It's the key part to recovery. So basically, where we want to get to is, my arm's doing this thing again. Okay, all right, never mind. I know what I need to do now. So these are what I can do. So let me use my breaths. Let me try and use my other limbs to be doing something to distract me. Can I go spend some time with someone and just like wait it out? Or can I get myself somewhere again safe if I'm out and about? So to wait for it to sort itself out, and then I go. Those are the things that can sometimes not be easily accessible when you're first diagnosed, or if you're feeling like it's completely overwhelming, and that's how FND works, because essentially this is all new. Your brain still experiences the symptoms as new, and so that with that newness comes shock, frustration.
Oh, absolutely. Yes. Yeah.
Disappointment.
That fear factor that we mentioned before sounds very ACT-based. That actually, that's right to ask. Then that if you can get to a point, which obviously takes time, where you're able to go, okay, I'm noticing that thing. Look, my arm's not doing what it should do, or I've got a tremor, whatever it is. And rather than hooking with the, why is this happening and I've got to stop it, all the kind of fear-driven, anxiety-driven stuff, it's just that, what can I do even with this? Is there something small, bigger, medium, somewhere in the middle? And that takes time, but I think it's quite important for people to kind of understand that that's a useful model.
Absolutely.
Because that is in your control, isn't it?
It absolutely is. You can't control the symptom, but you can control your response to it. And
absolutely.
So, and what I love about ACT as well is it talks about like being flexible, having a range of options. Panic will always be an option. It will. And sometimes we might
all
need
of us, not just with FND.
Exactly. But also, if you can learn to add extra options in, then that's really then you're starting to kind of get on the way to where you need to be in terms of recovery. And so what physiotherapy can often look like, it will depend on the particular types of symptoms that you're having. So if you're experiencing dizziness, it might be around reducing safety behavior. So instead of like kind of holding really onto the wall, to be able to hold yourself up, because that dizziness is really bad, and that is helping you feel safe. Can you start to feel safer with maybe putting your fingertips on the wall? And then so learning, and then this is where you go a little bit old school behavioral of just your body learning and experiencing what that feels like to have less support, and you can still manage that and tolerate that.
Old school, but effective. That's how I like to say it. Yeah.
Exactly. Or it could be helping somebody, like if you've got a tremor, sometimes what can be really, really helpful is having repetitive rhythmical movements and copying somebody.
Yes. We touched on this a little bit last time, which I was really interested in.
And what that does, essentially, is you're being really geeky. Your mirror neurons start kicking in, and like we're social beings, and we want to kind of copy what somebody else is doing. And if it's an unaffected limb, then there's something very so it's lots of repetitive rhythmical movement. So sometimes it's kicking a ball against a wall, or playing catch with someone. All that automatic, I don't have to think about this, my brain, my body knows what it needs to do. And this is the key thing that goes across all the areas of rehab. It's what is an activity, what is something that you do that allows you to get into like this flow state, what we call it, where your brain can switch off and your body can just trust to do what it's doing. If you were historically an athlete, it might be that running might not necessarily be available to you, or it could be that walking or jogging or kind of or swimming might be. Swimming's awesome for FND if it's within your, because again, your body just knows how to do it. It's an overlearned skill. Quite often, or if you've played a musical instrument, quite often you could be have quite significant motor symptoms, but then you put yourself in front of a piano or you play the violin, and then it just like your body knows what it's doing, and your brain, and it's that. And how wonderful is that to feel competent and to connect to that? And I am just going to put something in there that I am neither an athlete nor particularly no, I have no talent musically whatsoever. For me, it was jigsaws. So I know that it doesn't have to be like something spectacular.
So in terms of your own rehab, doing so people that may not yet have listened to the first episode, you very kindly shared your own personal journey with FND as well. So I think that's really important for people to go back and listen to as well, because I think not only do you have that fantastic clinical knowledge, but also you have that lived experience, and that's quite a unique combination, isn't it?
And I think in terms of like challenging stigma, I think it's really important, because I think that FND is really quite stigmatized in a way that people can talk about having anxiety or depression, and almost everybody now goes like, oh yeah, we get what that is. If somebody says they have MS, multiple sclerosis or Parkinson's, people go, oh, okay, we know what that is. FND is this in-betweeny, but you're like, what? What do you mean? Sometimes you can, like, sometimes you're paralyzed, but sometimes you might not be. Sometimes you need a wheelchair, but other times you don't. Like, So, what does that mean about you? So I think part of why I really want and why I'm really grateful to you for having me on is because I think we really need to challenge the stigma. And there's a wonderful charity called FND Hope, if anybody's not come across it.
I'll put it back in the show notes for this episode. It's in the show notes for the previous one we did as well.
They are all about challenging stigma. They've put on some wonderful work they're doing with ITN News around like our amazing brain. They're doing a documentary around people with lived experience of FND, and they offer free support groups as well. So if you do have FND and you're struggling to get some support, FND Hope, I would say, would be your best bet. Shocking, Tara. I've kind of gone off on a tangent. So
so we've kind of talking about physio. So we kind of broadened out from the original psychological we have, but then the other modalities that might be involved as well.
Absolutely. So physiotherapy is quite often one of the most important. Occupational therapy is also really important, and occupational therapists are around helping people be independent in their as independent as they possibly can be. And what that might look like in FND, it might look like reducing aids or getting the right aids for you or the right reasons. So, for example, sometimes you might need a wheelchair to kind of manage fatigue. So, for example, but you may, so it's a really tricky thing with wheelchairs as well. So it's important to have some professional advice about whether an aid is needed for you or not. Sometimes it's around.
That's important then, isn't it?
Yeah.
Because I'm just thinking there might be some family members, I don't know whether you come across this, but I'm just thinking back into my kind of head injury, brain injury days, where people might be meaning well and suggesting things, but actually it sounds like it's actually really important to make sure you get professional advice on that as well.
Absolutely. So, for example, if you are using crutches, it kind of allows you to like hunch a little bit. And that doesn't get into like a normal movement pattern. And so this is quite often what happens with FND is the things that we do to try to compensate for our physical difficulties can have inadvertent consequences of kind of making things a bit trickier. So,
and it's understanding that, being able to catch it as well. Because there may be people listening going, but I need that. I can't get around, or I might fall, or I can't get to work, can't do my job, can't parent, all of those things. But
can't get into college because I can't walk around college. I can't walk around college. I don't need my wheelchair outside of college, but I do need it when I'm in there because school lessons or college lessons do not stop to wait for you to have enough time to walk from one bit of the campus to another. Or if it's around needing a wheelchair, maybe that you are pushing it, or if you want to go for a walk along the seafront with your family, and then if you're tired, then you can then rest for a bit, and it means that you can then go out and do more valued activities. But like pushing the wheelchair allows you to have that better like posture and to kind of be able to kind of access those normal movements. And then what occupational therapy can do is help you, and alongside with physiotherapy, help you feel safer, get to that safety place without the aids, or is slowly reducing the need for the aids as your normal movement patterns come back. That's the overall aim. They can also be really, really helpful with fatigue management as well. So
that's important.
Yeah, because in terms of like learning how to prioritize, not always easy. Learning how
I'm thinking just working, parenting, so many demands that can be on us as adults.
Yeah, absolutely. Knowing how to pace as well, and like if I do this now, then I need to rest, and then I need to maybe do something else, or am I going to try to maybe do one physical activity, but then I need to do some like paperwork, for example, of like that life admin stuff that can be really overwhelming and cognitively tiring.
Let's not go on school apps. But that comes back to what you were saying before about the importance of that psychoeducation and a good formulation. There may be, we were talking about the fact that some people may have a few good days and then a couple of bad days or even weeks, is not being tempted then, because that's the thing that just came to mind for me then, to I'm having a good few days, let's get everything done, let's blitz the house, let's get that paperwork done, let's show everyone at work I can move around all day. But actually that doesn't sound like a helpful model. An understandable one, but not helpful.
Completely understandable, because why wouldn't you? If you can't guarantee that your energy is going to be there, why wouldn't you try and get everything done, or be like, yes, I finally feel like me again?
Absolutely.
But part of that as well is it comes along with the acceptance, is accepting that good days are potentially, it's not just the bad days that come and go, the good days also come and go. And can you leave something in your tank? And that requires a lot of trust in yourself and trust in.
It really does, doesn't it? Yeah.
And so, that's absolutely. And I'm trying to remember the third piece. So planning, pacing, and planning. Yeah, goes with pacing and prioritizing. So you have to kind of plan things in as well. That's the other thing as well that people don't often talk about. It's just all those things that used to be automatic, like just going out to the car and going off to the park or going to around the shops. When you have FND or any of the other, or long COVID or anything like that, those things that used to be automatic now require such a level of micromanagement, and that sucks.
And then because you might notice that this is now a thing and it didn't used to be, and why is it? Comes back to those questions again, doesn't it? Why
me? Why can everybody else do this? Why? And another thing as well that OTs can help with is sensory, depending on the OT, sensory integration, because quite often in FND our sensory systems can get overloaded. Our filter doesn't work quite so well, so often things can be too bright, too noisy. Things might feel a bit too tight or too itchy that we never used to be bothered by before. And there's also something, and I'm going to geek out a little bit around interoception.
We love it.
So,
bring it on.
So interoception is a word that essentially means like, how do we know what's going on in our bodies? And most people with FND really struggle with, like, how do I know if I am tired, hungry, thirsty, anxious? What are all these internal signals in my body telling me? How does it feel? How does one feel different from another? And then how do I know what to do with it? Because you can't do fatigue management if you don't know what those early signs of tiredness are.
Absolutely.
Getting people who get that element can be really, and also the same for pain as well. Like this doesn't just like knowing like those early pain signals, or like being able to, or if external stimuli kind of trigger off a pain response, knowing like, oh, okay, that's little. Because again, it's coming back to those whispers. Quite often we aren't very good at tuning into the whispers. I'll be honest with you, I borrowed that heavily from my let's just go with stole, from my colleague Kim Wilson up at Surrey Hills Rehab. That's
up for a bit of stealing.
Yeah. Stealing with
I like to reframe it as sharing.
Sharing, yeah.
Yeah.
So if your body just doesn't know how to interpret those whispers, then it will need to shout at you for you to be able
and again some of that stuff just strikes me as being so automatic for many of us, take it for granted that we know what our body is doing. So again, that kind of noticing if that's you and then things have suddenly changed, that must be hard.
It really is. Like I remember being in the car with a new, like I got a new to me car, and I was like, and I hadn't changed the seat position, and my husband was next to me, and he was like, "You look really uncomfortable." I'm like, "I am." He was like, "Well, adjust it, make it better." I was like, "I don't know how to, because I don't know where my body is or what I actually need to do to get me." He was like, so he was very good at just telling me like, "Oh, okay, well, actually doing it for me." He was like, "Does this feel better?" I was like, "Yes, thank you." Because I needed someone to tell me, I needed that external help to help me know where my body was in space.
Yeah. And also that you felt safe enough. That's the word of the day for me, the kind of safety to be able to say, this is what I'm experiencing and I need help.
Yes. Yeah.
And then that's okay.
Yes. And also trusting that you might not need that help the next day and letting you do it, which is, again, if linking back to what we talked about last time, I think, which is giving people autonomy as well. Yeah. So
that it's lovely that you had that help that day to move that car seat, but perhaps just helping those significant others know what you want in terms of autonomy going forwards, not to presume, perhaps ask, or that you can tell them when you do need help, when you don't, and that's all okay.
Boundaries and being assertive, and that things can change from day to day. Yeah, absolutely. I'm just so thinking about, I'm just aware of the time. So yeah, there's also speech and language therapy can also be really,
That's
really
the thing,
important.
that we want to get in as well, because I'm not
Yeah.
sure most people know what speech and language therapy is if you're not a clinician yourself, whereas physiotherapy, occupational therapy, I think are more familiar terms to people.
Yeah. So speech and language therapists can be really, really helpful in terms of helping you know, like how your tongue, your mouth, your vocal cords, what happens in FND is essentially they get disconnected. They're not these smooth, lovely automatic movements. And what can often happen with speech issues is when we're stressed, when we're feeling lots of pressure, or if we're very fatigued, essentially it can just affect how our muscles work, and it can make our speech quite dysarthric, or it can make it really difficult to find words, or it can
just let people know what dysarthric means. If somebody's new to that term.
Yes, thank you. So dysarthric means like a laboured, slurred, effortful. And also you can have functional swallowing issues as well. So things where you might find things getting stuck in your throat, which again is quite difficult. And so speech and language therapists can check this out. And I'm sure my speech and language therapy colleagues would really want me to say, like, reflux can often be a really like key part of swallowing difficulties as well, which is often underlooked. So it's when it can be really difficult if you've got particularly silent reflux coming up, with acid coming up from your stomach. And what speech and language therapists again do is around safety with speech and getting your tongue and your mouth, kind of all your things moving in a way that loosens them up and gets them automatic without the pressure of having to speak. Singing can also be really helpful because, again, automatic things. Yawning, because again, it's automatic. And our body just takes over when we yawn. So again, it's thinking around if speech is and speech was one of my issues, and that's one of the tricky things with FND. It's around it goes after again, for a phrase from my colleague Kim Wilson, it's a gremlin that sometimes goes after the things that are most important to you. And we can understand that because we pay lots of attention to the things that
we do.
Anyway, and the things like, so when my speech was tricky, I'm a psychologist, and you would never think I had speech issues given how long I've like rabbited on for the last like 2 times I met you, Tara. But if I can't speak
for you at that time, and you're thinking that you'd had that experience, but also when we come back to kind of that threat mode and brain panicking about the future, how often that might show up for you. What if that happens again? And you know what you do is so important. The talking is so important.
Absolutely. And what are other people going to think about me? Like I can hide a little bit if my legs decided not to work, I can kind of mostly like manage, like hide that a little bit if I'm out. Speech and literally, like, it's such a cool part of what we do.
It is literally the core element of what we do, isn't it? Essentially.
So I didn't know if I would have a career, essentially. But
I'd almost do a whole episode on that, kind of destabilizing. That's part 3. You know, that sense of self, what you do, all of that.
And I know we're coming up towards the end of our time, but I'm also holding in mind that if resources aren't out there, or no, there are resources out there, but if you're struggling to find help as well, or if finances are a bit of an issue and you do need to think about private practice, one of the key things that we talked about right at even before we started was psychological rehab for FND doesn't need to be you're signing up for weeks and weeks and weeks of weekly therapy, because that is really expensive.
So important.
It can be fortnightly, it can be monthly. And how I work is I tend to kind of say, like, try 3 sessions, like see how we get 3 as in the number 3. But I do offer reduced sessions if due to my
so that's useful then, that people can ask their practitioners,
absolutely,
what could this look like, and that together you can discuss that and come up with a plan.
Absolutely.
But also there's no shame in asking whether people do offer reduced sessions?
Some people will, some people won't. Some people offer like a certain amount of slots. So or they might be able to provide you with some resources to kind of while you're waiting as well. So
that's all so important, because there may be people listening to this who are in the early stages of getting a diagnosis or recently have, who are then worried about getting access. And obviously there's NHS routes, and we've talked, there are services for FND, but then there, in some localities it's about sourcing those people individually. But if we said asking questions, what do they provide, what could it look like? But then there's the private practitioners. But even within that, there's flexibility in different models.
Absolutely.
Yeah.
Absolutely. And most practitioners, we would know other practitioners as well. So we're a small but mighty community in the FND Sussex community. So we
I love.
Recommend like people, or can recommend people get like NHS services as well. So that's always the key point.
But the safety in that, because then also, my other sideline is, who you're getting, they're qualified, they're regulated. And I think sometimes for families, that must be really welcoming to know who they're going
to. Yeah. And I'm going to do a little plug for your book as well. But if you are concerned about like, how do I know if I'm getting the right therapist? And what I loved about your book as well, it's not, I think there's so much applicable to allied health therapists as well, allied health professionals, as well as psychological therapists as well. It's HCPC registration. You can ask people about their experience and what they do as well as what they don't do.
And it's okay to ask them. That clinicians, whatever your profession, we don't mind people asking us. We want you to ask us. Look us up. Ask those really tricky questions.
And it's okay if it isn't necessarily always a good fit.
Yeah, absolutely. Absolutely is.
Yeah. Thank you so much, Tara.
I just say we could probably just keep doing episode after episode, but my big takeaways today, there's something about safety, values, asking questions, but also kind of busting those myths that, I'd like to see somebody. So we know off the back of our last podcast, people want to know more about you, Michelle, don't they? But there may be those questions of, do I have to see you weekly? That absolutely have those discussions of what it can look like. It doesn't have to be this, rigid model. So even if you're booking in and having an assessment with someone and then taking it from there, those are all really valued things. So people have or may have listened to the last episode, but where are you? Because people are going to now want to find you. Where do you hang out? How can people get hold of you?
I hang out in Horsham. And
good place, good choice. I like Horsham.
Yes. But I can see people online, nationally and internationally as well. I'm fully insured to cover people internationally as well. So, and when I'm doing my equine work, that tends to be a bit in Surrey, and yes, that's a whole other conversation. Oh
well, I have a podcast episode planned with your lovely colleagues, so we're going to be covering that. I can't wait myself to learn more about equine therapy as well.
So thank you so much for having me on, Tara. I really appreciate it.
Oh, it's an absolute pleasure. I always love talking to you. So I'm definitely going to do part 3 at some point as well. There's so much more that we can cover, which is lovely because we get feedback from people and that can help us know what we want to cover more of. Is there from today just one little adversity takeaway that you could leave us with?
Adversity takeaway, that essentially being compassionate to yourself can give you space to pretty much. It can really strengthen your sense of like your own sense of whether or not you can overcome this adversity.
And I love that. Hope. We're ending on hope.
Yeah, absolutely.
Thank you for bearing with my post-COVID cough today. I'm sorry that I've been kind of coughing all the way through. It's lovely to have you on, and I'm hoping that you'll come back super soon. Go look Michelle up, everybody. Read more about